Hello and good morning everyone. This is me Durchana Chetty, one of the student nurse at Western Senior University, and today I'm going to give an oral presentation on asthma. So let's get started. Did you know that asthma may lead to life-threatening attacks? According to the World Health Organization, asthma affected an estimated of 262 billion people in 2019 and caused 46,100 deaths. Also is affecting 300 people around the worldwide. In context of Australia, 1 in 9 Australian people have asthma, which counts for 2.7 billion people. Asthma affects people of all ages, so it does not discriminate in the age. Today in this oral presentation, I'm going to discuss the case study of Jackson Smith, who's 18 years old with diagnosed with asthma since the age of 2 years old and have been admitted to the emergency department in hospital. And I will also illustrate the pathophysiology of the clinical manifestation of asthma. So let's get started with the definition of asthma. Asthma is a long-term lung condition that can be managed but cannot be cured. As you know that the main function of lungs is to supply enough oxygen in the blood and to remove carbon dioxide from the blood. The proper function of gas exchange depends on the clear passages of the airways. In asthma, patients' airways become inflamed, swell, and make it difficult to breathe, and therefore the clinical manifestations of asthma arises. Pathophysiology of asthma. Bronchial constriction is the main cause of airways inflammation in asthma. The airways become hyperresponsive. The excessive inflammation of the airways causes swelling and tightening of the smooth muscle around the airways. Airflow is restricted and the normal function is affected when the airways are characterized by hyperresponsiveness and bronchial constriction, which leads to airway restriction, which manifests the symptoms of asthma like coughing, wheezing, and shortness of breath. In the given picture, we can see that pathology of asthma. There is a picture of normal airway, asthmatic airway, and asthmatic airway during attack. In a normal airway, we can see there is no inflammation, there is no mucus, and we can see the air can pass through easily. Whereas in asthmatic airway, there is inflammation, there is mucus, and there is the wall is very thick. So we can see that from here, it's very hard to pass the air. So it is the airway of the lungs. So we can see in this lung it is easier to pass through air, and whereas in asthmatic airway it is very difficult to pass the air, and therefore it causes clinical manifestations like difficulty in breathing and chest tightness. All these things can happen when there is inflammation, when there is a lot of mucus available, and when it is difficult to pass through air from here. Overall, people with asthma have sensitive airways. Asthma can be triggered by various external factors like pollution, stress, smoking, tobacco, poor air quality, cold and hot temperature. In patients with asthma, the inflammation triggers and thus increase the work for breathing, make it very hard to breathe. So we can see in the picture as well, there is inflammation factors, irritants, and others like allergens, and all these factors triggers the asthma, and that's how the asthma attacks can occur. Now I'm going to discuss some of the common signs and symptoms of asthma that includes wheezing, cough, chest tightness, dyspnea, hypoxia, nasal pharynx, sputum is thick and tendinous, decreased or absence of breath sounds called silent chest. In relation to our case study, on admission to emergency department, the clinical manifestation of Jackson Smith were severe dyspnea, inability to speak sentence in one breath, and respiratory rate was 32 breaths per minute, and SpO2 was 92% on room air, pulse rate of 130 breaths per minute. These all are the symptoms, signs and symptoms that Jackson Smith showed in admission to emergency department. One clinical manifestation that I'm going to discuss in this presentation is dyspnea. Dyspnea is the medical term for shortness of breath, sometimes called as air hunger. Dyspnea is a subjective sensation of an uncomfortable breathing, commonly known as shortness of breath. It is most frequently described as an inability to take a deep breath. Normally, when we breathe in air, we get oxygen into the bloodstream and we breathe out carbon dioxide. In asthma patients, the airways are inflamed and tight, making it very difficult to breathe, which can restrict the normal function of the lungs, making it difficult for breathe. Um, One nursing intervention that will help to improve a patient's condition is by using a high filer's positioning, which is defined as the positioning of the patient's upper part of the body between 60 degrees to 90 degrees. The leg of the patient may be straight or bent. High filer's position can be used when the patient faces difficulty in breathing or undergoing breathing treatments. High filer's position helps to ease breathing. Like you can see in the picture that uh, 90 degree to 60 degree is a high Fowler's position, and between 30 degrees to 45 degrees is a semi Fowler's position. So when we put patients on 90 degree to 60 degrees, it helps to breathe for the patients. The patients can breathe more easily, and it's a little bit easier to breathe when you put the patients in 90-degree position. So first intervention that I will do to help Jackson Smith is to put the patient in high Fowler's position. In conclusion, I would like to say that asthma is a chronic lung condition that affects airways of the lung. It is a respiratory disease. Asthma can be managed, but remember, it cannot be cured completely. Asthma is a burden to society. It increases the healthcare costs. It increases the hospitalization, and also for individual. For individual, it can be very stressful going through the medication, going through the inhalers, and being aware of the triggers. People with asthma and their families need education to understand more about their asthma. As it can have some life-threatening attacks, it is always better to avoid the triggers like smoking and stress and pollution. Such things can be managed. So at last, yeah. And at last, I want to say thank you for watching my video and for your time.